On the phone with us now is Dr. David Samadi. He is a urologist from Lenox Hill Hospital in New York. Doctor, thank you for taking the time.
It's my pleasure.
Doctor, it looks like this was a pre-planned event, maybe from images or whatever that necessitated her to go to the hospital, have this taken care of. Is that your read of it at first blush?
Neil, I think it doesn't necessarily need to be a pre-planned findings. I mean, a lot of times what we're finding is incidentalomas. These are incidental findings where someone may have very vague symptoms, nausea, vomiting, back pain, sometimes even like faint kind of feeling. And we find them on MRI and CAT scan to have a lesion in the kidney. Now, I think John was actually correct, and my diagnosis would be also angiomyolipoma, as it sounds like. Angio means vessels, myo means muscles, and lipoma means fat. This is a kind of benign tumor that we usually see in the 4th to 6th decade, usually seen among women, so she's a perfect match for this benign tumor, even though we're speculating. I'm not her doctor, but that's what it sounds like. And a lot of times, if it's over 4 centimeters, we would be worried about possibility of either growth in the future or possible bleeding, which is what some of these vessels in these tumors can do. They can burst and cause some bleeding in the back. So surgically, you know, we used to remove part of the kidney years ago, but once embolization came in the picture, it made it much easier by pushing some of these coils or polyvinyl alcohols or emboli agents that we put in these tiny little vessels that goes specifically to that mass, obviously not the rest of the kidney. We can shrink those benign mass or tumors and basically shrink them and avoid any kind of surgical treatment. And that's what it sounds like. Now, the reason why they're watching over the next few days is to make sure that this is not affecting her kidney function, that the rest of the kidney is viable, that there is no complication as far as bleeding, infection, and those are the kind of things they have to look for.
So the fact that she's in the hospital a few days and will be there through the bulk of the week, doctor, should we read anything to that? A lot of folks are emailing and worried, and what do you tell them?
Not at all. I think she's going to get bored because I think a lot of these procedures are fairly routine. We have been doing embolization for the last almost 30, 40 years. And I think it's been used for liver. Now we're embolizing even in large prostate instead of just shaving the prostate. And even, as John mentioned, for myoma in women for having this big mass on their uterus. So this is a fairly, if there's such a thing as routine procedure, Neil, in medicine, this is a fairly routine procedure in the hands of interventional radiologists. And I think we're just going to like watch her to make sure that she's fine. My speculation is that over the next 2 or 3 days, she'll be able to go home without any incident.
All right, let's hope so. Dr. Samadi, thank you for taking the time, sir. I do appreciate it.
You're welcome, anytime.